Why are Black women disproportionately having challenges that our white and Latina and every other ethnic group counterparts aren't having? It's all of the things that impact our lives.
We have to start looking at racism as a public health issue. And we're going to create a model that can be replicated throughout South LA and throughout the country, because we have to, as a community, all of us have to come together and fight racism as a public health issue and make sure that our Black women and babies are safe and are healthy. And that's what we're going to do here at St. John's.
Until we change the systems that we work within, we cannot reduce the stress level of the individuals who are impacted by that level of stress.
We need to make a difference here. We need to decrease those numbers. It's too much, and we deserve to live like everybody else does.
I have a personal friend who's a doula in Sacramento, and she tells a story. She talks about a successful birth, and she shows the baby's face and the mother. And she talks about the doctor who was in the process of sewing the mother up. And he says, "Oh, what are you going to name the baby?" And she tells him the name. And he says, "Oh, that's good. That's an easy name to pronounce for when she has to get a job." Who says that about a baby that's minutes old? So remember that story. Trust me, I am, as I'm thinking through the systems of systemic racism and classism and sexism that I am trying to chop down every day of my life to create a better opportunity for the baby in Peach. Harmony. Of course that's her name. And it's a beautiful name. And it will be easy to pronounce when Harmony is on the ballot running for president of the United States.
Welcome to the National Newspaper Publishers Association's Let It Be Known. In response to the alarming racial disparities in maternal health, particularly the shocking statistic that the maternal mortality rate for Black women is over 3 times higher than for white women, St. John's Community Health in Los Angeles has taken a powerful and proactive step forward. They've launched a groundbreaking initiative called Committed to Black Wellness and Health. This program not only acknowledges the systemic issues at play, but also seeks to directly address them by providing Black mothers with skilled advocates and a community of women who truly understand their experiences within both the world and the U.S. healthcare system. What sets this program apart is that it is being built from the ground up by the very mothers it aims to support, ensuring that solutions to the Black maternal health crisis are tailor-made to meet their unique needs. Heather Alexander is the director of Committed to Black Wellness and Health, and Heather joins us now. Thanks for joining us, Heather.
Oh, thank you for having me. I appreciate it.
Oh, absolutely. And such a crucial issue that we see Black women continue to face. Can you share, Heather, some insights into the inspiration behind Committed to Black Wellness and Health and the specific goals you aim to achieve through this program?
Okay. First of all, like I said, thank you for having me. So St. John's started the program. We were given a grant by LA Care to start the program to address the Black maternal and infant crisis that's going on. It didn't just start. This goes way back. way back,
Right.
right? It wasn't until families started speaking up and advocating for their loved ones who have passed away now that it's becoming big, right? So St. John's has taken the initiative to address that. I was brought on, and I took off running. I wanted to be on fire about this um, because it's alarming. The numbers are alarming.
Yeah.
Black women, 3 to 4 times more likely to die in childbirth. And then even our babies, right? They're 4 times more likely to die in childbirth than our Hispanic and Caucasian counterparts. And most of it could have been prevented. So
Right.
that's where it's really alarming. The
Yeah.
doctor's not listening, nurses
Mhm.
not listening, the woman being ignored. And it goes back to racism. This is like a public health issue now. Racism is a public health issue.
Yeah, without question. Every time we talk about this topic on this program, I always go back to Serena Williams and her experience. She wrote about it last year, and you tagged it. She talked about how they didn't listen, how they wasn't hearing her, how they ignored her, and I always go back to this when I talk about Serena Williams in that respect, is that you have someone who's Black, of course, but you
Mhm,
have somebody who's rich and famous and still
mhm.
was treated like she was Serena Jones
Absolutely.
in that maternity ward.
So yeah, yeah. So that's the problem here. It's not just like a socioeconomic problem here. Studies show that a lot of the women who have passed away have degrees, make good money. It doesn't matter. It's just the fact of being Black.
Right.
And that's why we know it is racism. So that's where we come in with this program, so we can teach our mothers how to recognize the different racisms, how to be vocal, how to advocate for themselves, and now they have us to help them do that.
Which is absolutely awesome. And as you mentioned, that this isn't new. So tell us, how has the program evolved since its inception, and what have been some of the most significant milestones or successes you've witnessed so far?
Okay, so I'll start off with like the best news is that we see healthy babies coming in,
Absolutely.
even with mothers who have had emergency C-sections with the preeclampsia. We have we call them CBWA babies. So committed to Black wellness, and the acronym is CBWA. So we call them our CBWA babies. That's our testament right there. The mother coming home healthy, the baby coming home healthy, and still learning about, their body, the baby, how to nurture, how to parent, how to the nutrition behind it, the exercise, and most of all, the mental health and the rest that they need. So we started out at zero, at zero. I came in, I was able to hire a case manager and then an outreach coordinator, and we just took off running. We went into the neighborhoods. We partnered with a lot of community organizations that are around, and we developed MOUs with them, and we just started bringing the women in. So I teach 8 prenatal courses and 8
Wow.
postnatal courses. That's part of the program. Those are part of our deliverables. But I don't like to call it class. I like to call it a support group. I am a Black mother. I'm a new grandma,
Oh,
and
wow.
like so it watching my daughter go through this was terrifying. I'm teaching this, I'm advocating, I'm doing this, but at the same time, I'm waking up like anxious, stress. Is my daughter going to be okay? I need to make sure that I'm there so then I can speak up for her. But, everything turned out right. But that's this is why it's really important to me, because me as a Black woman, I want to make sure that my other Black women are getting the same care, if not even better. So then they're able to come out healthy. The babies can come out healthy, and then just decrease the anxiety, the depressions behind it. Um, we have the eight prenatal, 8 postnatal, but then after class, I spend 30 minutes as group therapy focusing on mental health, depression, postpartum depression, anxiety, and things like that. Uh, Lunch is served. We do everything family style. It's not, like I said, no classroom setting. We do Q&A. The mothers speak amongst each other. It's like a social, like, kind of camaraderie thing going on there. And we have a good time, but at the same time, they're learning, and they are learning to speak up for themselves. They're learning what tests they need, what imaging they need, when they need it, what gestational period they need it. And so they're able to check the doctor and say, hey, I didn't get this test. Is there a reason why? And the
Right.
doctor can explain. And if the doctor can't explain and they come back to me, then I'm able to go to the doctor hands on and say, hey, what's going on with this? And how can
Yeah.
it be addressed? All the way up into the hospital. If there's a problem, then we deal with it too at the hospital. So they get free diapers every time they come to class. They finish the first 8 prenatal classes, they get a car seat. The last 8 postnatal classes, they get a playpen. But every time they come, they get free diapers. And then whatever's donated from our partners, like clothing, brand new clothing, toiletries, things, we just make sure that we're able to provide for them. So it's just less stressful. St.
Yeah. 'Cause-
John's comes with a primary care, OB, pediatrics, vision, dental, mental health care. And then we have a programs department that's so amazing. It has over 40 partners that can help our mothers with childcare, resources to childcare, education, DV, domestic violence, substance abuse, housing, you name it. So they have it here in a one-stop shop, but at the same time, this program to really help them get through, reduce the stress, reduce the anxiety, manage that depression, and on top of that, be able to be vocal and learn how to advocate for themselves when they're in the hospital. And we also have a partnership with hooking them up with doulas. So
Yes.
if they can't do it, then we have the doula there that can do it for them.
And that is awesome. I know Vice President Kamala Harris is one big advocate of doulas, and
Absolutely. Yes.
she often talks about that. I have a daughter. My oldest daughter is also a doula as
Nice.
well on the
Mhm.
West Coast. So she gets she sees a lot of things out there
Mhm.
as well.
Yeah.
But one of the unique aspects of this program is that it's being developed by, as you already stated, mothers themselves. Can you elaborate a little bit more on how this approach contributes to more effective solutions for Black maternal health?
It's all about the experience, right? We can all relate. It's all relative. We come from the same type, like different backgrounds, but however, like similar, like the culture. Um, so when we get together, we're able to relate on the different topics or things that grandma said or things that mom said. So it makes it more like a family. It's
Yeah.
support, and that's what they need. A lot of them come in without a partner or without a support system. So it's like the support that they have there with the women that are there, the Black mothers that are there, the children are there. Some of the partners do come in, or the grandmother may come in, but we can all relate to one another, and that's what makes this so unique and it makes it stand out, so that we're able to just get the word across. They're more, um, how would I say, they're more inapt to learn, right? If they're in a environment where they're comfortable.
Yeah.
And that's the thing about it. I want to make sure they know, like, you can be comfortable here. You can be yourself here. You can talk about anything here. I'm a clinician. I can help them out with the mental health part of it, or just my experience as a Black mother, and then what I've learned from the growing baby, or how your body is growing during pregnancy and after pregnancy, how to treat your body after pregnancy, and how to nurture that baby. So yeah, it helps by to answer your question by just being able to relate to one another.
Yeah, and that learning environment, a very good learning environment, as you pointed out there. That's, I'm sure, it's also really crucial. You've mentioned on a couple of occasions now the mental health aspect, the stress. It's just stressful, I'm sure. So you go through the excitement of finding out you're pregnant, right? And the excitement of carrying that baby, the listening to the heartbeat, et cetera, et cetera.
Mhm.
But then comes the stress, not of, and the anxiety, apparently not of actually giving birth. It's the stress and the anxiety of what type of care you're going to get.
Absolutely. The quality care in a culturally competent environment. How are you gonna? How is that gonna be managed?
And
So,
based on all of things that have gone on, and obviously you guys are doing some great work out there in Los
mhm.
Angeles. What advice would you offer to expectants, particularly first time expectant moms, Black
Mhm.
moms today?
Mhm. Take care of your mental health. That's the first thing. Um, Therapist, if you're here in Los Angeles, you can come here. We have mental health care. Come to our support groups. But your mental health more than anything, because that's the thing here. It's the stress behind it that makes the blood pressure go up, or if there is some type of blood sugar problem. All of those things take part in that, right? Of, you know, the dangers that can happen during birth. So it's
I get it. I'm
yeah,
a man and I get it.
yeah.
but
It's the stress. It's the stress. And
yeah,
so taking care of your mental health, the first thing, and then making sure, please go to your doctor's appointments. Don't go off of oh, well, back then we're not there anymore. Times have
right.
changed. Everything's evolving, technology, everything. Go get your lab work, do your imaging, make sure you make all of your appointments. Take care of yourself and the baby. It's not just the baby, it's you too. Eat right, do your walking. It's not even strenuous exercise, just getting the walking done and treating yourself well. And then if you don't have like that support system, try to get with someone in your community, a group or organization, a church organization, so where you can have that, so it can help you decrease the stress and things that you're going through. You need someone to talk to.
And also, if you will, Heather, could you talk about the importance of having that advocate in that room with you when you're
Oh,
giving birth?
let me tell you, I'm so glad you asked that question. You know why? Because I grew up in a family, a huge family, and I'm the oldest out of 60 something grandchildren, great
Oh,
grandchildren,
ah.
and now great great. Yes, yes. And so we were all there, like, watching, babies come in. And so I'm the nurturer of all of the
Mhm.
grandkids. So I held them all. I helped them. So walking into the delivery room, number one, stress because I'm worried about my child, but I knew she had a doula. But I was like, I'm her mom. I know best. I walked in with that attitude, and I had to humble myself really quick because not only it was the stress on my daughter, it was on me because I was watching my daughter and I was like, I want to make sure she's okay. But we had that doula there. So when I asked, what is this number? Why is it going up? She was able to explain it to me.
Yeah.
She was able to, like, as she was going through, she was able to follow my daughter's birthing plan the way she wanted it. My daughter and her husband created a birthing plan, and there were doctors coming in, well, midwives coming in saying, hey, we can change. And the doula was like, no, here it is. They have their birthing plan. This is what we're going to do. And it gave me time to focus on my baby,
Wow.
having a baby. It gave
Yeah.
me time to hold her hand and be there with her and her husband. It gave us time to have that personal time so we can ease her stress throughout this. The doula handled those things. And by the way, our doula was amazing. A Tia. Yes, yes, but it helps out so much. And if you can get that and you have that insurance to do it, I mean, it's literally a lifesaver, a lifesaver. Mhm.
Wow. And also, we talk about this a lot too. We cannot overstate the importance, the significance of having Black doctors and staff
Oh,
leading
yes.
the way.
Yes, yes, that is most important. One of our mothers came in, she spoke at our resource fair, and no one would understand when I said, they're like, well, what's wrong? Why isn't anybody coming into the clinics? And I'm like, there's nobody that looks like them. So there's no trust there. We've been experimented on. We've had things happen to us. You hear everything that's happening in the news. Why would we want to go somewhere where we're like, oh, nobody can relate? Remember, we're relating to each other. So I built a team. so that they can walk in and relate to someone. But that mother, she said to herself, she came in here in tears crying. Her insurance got canceled. She had to get emergency medical. So then she was forced to come here, and she was 38 weeks pregnant. And she was
Oh,
so used to her Black doctor. But then she had to come here and she was in tears. And the first thing that came out of her mouth is, I walked in and there's no Black people in here. There's nobody that looks like me. And I said, here we are. But she delivered a healthy baby. She got the care that she needed, and everything was okay. And unfortunately, it doesn't happen like that all the time, but that's what we're trying to do here at St. John's, so we can make sure that it happens all the time. We can't control, the chronic illnesses and diseases that are
yeah.
going on, but what we can do is help them know what they're dealing with so then they can take care of it before it gets worse.
Yeah. Heather, looking ahead, what are the future goals and aspirations
Mm.
for Committed to Black Wellness and Health?
We want to make sure that this expands not only to all of our clinics here at St. John's Community Health, but our community, and then start hitting state to state. I want this everywhere because we need this. We need this. I mean, it's a long time coming. We need to be heard. We need to be listened to. We need to quality care like everybody else. We deserve to live like everybody else. We're human beings. All of us are human beings.
You deserve
And
to have healthy babies
exactly. And be healthy myself,
and
right?
be healthy yourself. Yep.
Absolutely.
So, if you will share, maybe a testimony. We're not asking for any names, obviously, but share maybe a testimony or story from mothers who have benefited from the program.
Okay, so on the resource fair, actually, there are two mothers that spoke up, and I know I can use the name because they did it publicly. There was press there, but there's Kaya, who came in. At the time, she was homeless. We're able to get her into an apartment, and she had a lot of challenges going on. Um, then she started having health issues where she had like headaches all the time. And I would say, well, did you get it checked out? Well, with pregnancy, headaches do come. And the doctor would tell her, it's normal, it's normal, it's normal. And it can be normal. However, they were coming in too much. And then they started getting.
Oh, wow.
So she said, oh, you know what? I'll wait. Let me get through this weekend. I'm like, no, Kaya, this is what we're here for. Let's hit it. Let's hit the urgent care. She was kept, and she had to have emergency C-section. Her blood pressure was sky high. She had preeclampsia, but her and her baby are healthy today.
Mhm.
The baby did have some heart issues, but now that's being taken care of. But her and the baby are here, healthy today. It's Zalara and Kaya, and then there's also Regine, who had the same thing happen with her. So we were able to catch that where they probably would have stayed home if they didn't learn what they did in class. So
Wow.
yeah,
That is.
it's helping, and it's not just them. There's a
Mhm.
few of them, that have problems with their babies where the doctor didn't listen, and we were able to step in and help.
Wow. And so,
Mhm.
how have their experiences, Heather, with Committed to Black Wellness and Health shaped their journeys and other people's journeys? People see these stories
Absolutely.
and they're inspired.
Because they're telling their cousin, their friend, and they're sending them here. We want everybody cared for. Will we do the best that we can to touch everybody? We do the
Yeah.
best that we can.
And Heather, what broader systemic changes or policy shifts you see uh, that might be necessary to address the racial disparities in maternal health on a larger scale?
We need to get in the hospitals. We need to start making people accountable, holding people accountable, rather say, the doctors, the nurses. Who is this? Who has this mind frame to treat others that way? And get them out of there. Get them out. Get them out and put somebody that wants to be in there, that knows that every life matters, our Black lives. But we need to start there. Start there. Get them out.
Yeah.
Hmm.
And how can initiatives like yours serve as a catalyst for a broader change?
Well, we're going into the hospitals. We're holding them accountable. We're not stopping with, oh, file a grievance and it stops right here. Okay, well, what's going to happen after here? Okay, well, who's your director? Okay, well, then who's this? Well, let's go all the way up to the CEO, because we need to let him know this hospital that you have, that you're making money off of, right,
Hmm.
are also killing our women and our babies by not listening and by not taking care of them, giving them the quality care that they need. So I know that this program would not only help our mothers, it helps our babies, it helps our future, right? Our future with our babies growing up and them having babies and having just learning how to speak up for themselves and making a change. But until we get into the hospitals, the staff there, the doctors, and finding out like who's doing this, who has pulling the complaints, pulling the grievances, and saying, okay, you know what's happening with this? We need to pull this out because it's not working here. We're not doing this. It's not tolerated. It's not tolerated. We need to get them out. We need
Yeah.
to get them out. There's no, oh, second chance or anything. No, you're out.
And Heather, for those who are interested in supporting or getting involved with Committed to Black Wellness and Health, what are some ways they can contribute to this important cause?
Ooh. So the donations for like diapers or clothing, toiletries. You can contact any St. John's community health clinic. You'll be able to get a hold of me. My name's Heather Alexander. My outreach coordinator, Lydia Callens, and my case manager, Rachel Bishop. We have a Instagram. It is SIBA Black Moms. Go on, you can message there or like send a quick caption on one of our posts. Anyway, but we also have a QR code on our website where they can scan and they can register. Mothers can come in, but if anybody can help or wants to donate, or even come down and speak, like say if you're another organization to speak something that may help our mothers, we welcome you. You can come and speak in one of our classes. Just contact us. That's it. It's
Wow.
just as simple as that. Just contact us. We're
Yeah.
on it. We're on it.
It sounds like a pretty amazing program that has
Thank
been
you.
developed there at St.
Mhm.
John's Community Health in Los Angeles. Folks need to check it out. It's
Absolutely.
so vital today. As we had this conversation, you think about as Heather brought out the stress and then the mental health aspect. We don't often think about the mental health aspect of giving birth.
Mhm.
And now it seems like with programs like yours, Heather, there is more of a push toward that. Why haven't it been there before?
Do we want to go there? Do we want to go there? Because that goes way back, and I
That
think you
goes
know
deep,
that
huh?
too. Goes real
Look,
deep, runs
if
real
it
deep.
if anybody knows how 60, you said 60?
About 62.
62, and you're the oldest.
I am the oldest. My daughter is the oldest great grandchild, and now she just had a baby, and that's the oldest great grandchild. We are a
Wow.
strong family, Alexanders.
So you're the perfect person for this job.
I think so. It was a blessing and sent in disguise, because when I applied for this, I knew it was going to be a program director, but I thought just like in a facility helping, the maternal patients. But then when I read and I said, oh, okay, this is where I belong. I prayed for things like this. I prayed to be at a place where I wake up in the morning and say, you know what? I love going to work because I'm doing something that needs to be done and I'm helping someone else. So there was only a blessing from God. And I thank him so much for placing me here. And I hope that I can do the work that he has for me here. I hope that I can complete it here.
Well, you say you're helping someone else. You're helping a whole lot of
I
someone else.
hope so. I hope
And
so.
we really appreciate you sharing this powerful information with the Black Press of America. Keep up the great work.
Thank
Um,
you.
are you on social media? Can folks follow you, Heather?
Yes, absolutely. I'm Alexa girl, so that's more the personal one, but I don't mind. Follow me, request me, Alexa girls, HALEXA, then girl, You can follow me, but please follow Seba Black Mom so you find out what's going on, what we're doing. It's a new account, so we don't have that many followers, but we would love for you to follow us so you can find out, like I said, what's going on, or even join us so we can get the word out there, and then you can also reap the benefits of good health, quality health, and sisterhood.
Well, Heather, keep the Black Press posted. We like good news like this because it is good news when we know that organizations out there are helping Black women with their maternal health is so vital. So thank you for all
Yes.
you do.
Oh,
And
you're
thanks
welcome.
again
Thank you.
for
Thank you
joining
for
the Black
having me.
Press.
I appreciate
Absolutely.
you. Have a good day.
You too.
Bye.